With pool testing kicking off soon in Metro Manila, what is the best move for the private sector in testing? Let's hear now more from Dr. Minguita Padilla of Project ARK. Dr. Padilla, thank you so much for joining us on The Final Word. There have been various opinions on whether rapid tests are indeed very effective. What about in Project ARK? How successful has it been, the rapid antibody and antigen tests?
Okay, good evening, Rico, and to everybody watching you. Let me first, we'll go to the pool testing later or now and go to the antibody.
Let's go to the antibody first and the antigen tests.
Okay, we started, let's go back to April. This is when we started in Project ARK. If you recall, in April, we had nothing. Our PCR was what? RITM. It took weeks, months to get your results. Companies had to continue working in spite of the ECQ. And I would like to just tell everybody that I'm really very sorry. It's not because of there was no, irrational use of antibody testing in these companies. In fact, I'm sharing with you now evidence, such as in Ayala, a group of companies, 30,000 people. They had to keep working. You had your tellers, you had your linesmen, you had your construction workers, you had so many people, no? They were able to contain the IgMs, which are the active cases, at about 1.8%. And then it stayed that way for the last 3 months, April, May, and June. But then the IgG started going up, meaning recovered patients. We have the data. It was only when we opened up the economy, when we went to GCQ, that there was a spike, which is expected in the entire Metro Manila, because people started going out and maybe being a little careless, no? And less careful. And this is happening even around the world. So we learned lessons from that. But as to how it was working, think about rapid antibody testing. There's a wrong way to use it and a right way to use it. If it's used in the wrong way, for sure it will cause problems. I remember somebody said, people are symptomatic, and when they test negative for rapid antibody testing, they clear them. That is the wrong way to use it. You will really get into trouble. Okay, you'll be releasing people who might be infected.
So, Dr. Padilla, what is the right way to use these rapid tests? Should there really be a medical professional who should be conducting these tests?
Well, they should be supervised by a medical professional. The problem with rapid antibody tests, it became so easily accessible, even through the internet. And you had people left and right buying them even in their homes, no? And some using them without knowing how to interpret them. So it became like, negative ka, wala ka ng problema. No, if you are being done by a doctor, they'll tell you, it's either hindi ka pa na-expose or you're in your very early part of your infection that you don't have antibodies. And all the time, there's always the advice, mag-ingat pa rin. You still have to wear your mask and practice all the... Now, this is the problem because so many people were using it. Another problem, Rico, we noticed is sometimes people were using it just to make money, overpricing it, or forcing people to have it done when it was not necessary, okay? It's great. What we found, it's great for seroprevalence, for checking if your workers, like every 2 weeks, if there's something happening. Like recently, an air-conditioned repairman was negative. After a month, he became positive IgG, IgM. So within those 3 weeks, he got infected, but he was recovering. That's a good way of, and another thing is you can contact trace. Because if they're IgM positive or IgM, IgG, you can now go to their relatives, their close contacts, 1:37, and then you test them and find either symptomatics or asymptomatics. Because the beauty about this is you see them early enough, the contacts, and you can actually do your PCR or you can do your quarantine, no, if they have any symptoms. No?
So, Doctor,
there's a right way and there's a wrong way. Yeah.
Correct. Fair enough. Let's now shift our attention to pooled testing using the RT-PCR, which is the gold standard. How effective is pooled testing vis-a-vis individual testing?
Yes. Again, pool testing, you can only do pool testing if you expect the prevalence of the infection to be low. We're saying less than 5%. Because if it's high, you might as well just do individual testing, okay? Now, pool testing, we didn't just say, okay, we're going to do pool testing. No, it went through several phases, no? First, RITM had to check which of the kits is fitted or amenable to pool testing so that when you use it even for more than one person, it will be still okay, still accurate, okay? And they found some. Now, next is to see how many can you pool at one time. According to RITM, you can pull 20, but we're going to start conservative, maybe 5 to 10 at a time first. Okay?
All right.
And then I want to correct what you said earlier. You don't do one swab, you do several swabs. For
All right.
example, you swab 10 people, but you put them in one solution and you test, but you keep the swabs for future reference.
All right.
Also first
Doctor,
use.
briefly, before we let you go, we just have some bad news because the Philippines has basically overtaken Indonesia today with the most number of infections and active cases in Southeast Asia, and our numbers have even surpassed China. Maybe in 3 short points, what can the government do during these 2 weeks as to not waste the quarantine period?
Yeah. Well, one is I think they're going to have a command center already tomorrow. I don't want to preempt it, but we need more quarantine facilities, and the command center will help people find these very fast. It is a problem. You cannot quarantine them at home. That's a big mistake. You'll end up just spreading and spreading.
Second
2
point?
is we have to learn from our mistakes. When we opened up, we became careless. Many people became careless. Now we learned. We cannot let our guard down. It has to be, and government will have to give away masks. They have to, instead of arresting somebody without a mask, give them a mask. Okay? There has to be less fear and more feeling of more caring, so that people will be less afraid, to be more responsive to government. Then we can do actually, contact tracing, they already said that. Then we can do simple things, okay? One is, one of the main places where you have a lot of spread are the barracks. Barracks where you have construction workers, policemen, soldiers, students in dormitories. Some scientists told us, why don't you do your gargling with povidone iodine twice a day, 3 times a day? Because it kills the viruses. Simple things like that.
Okay.
Take zinc, take vitamin C, get your sun exposure. And nothing beats just being vigilant.
Thank
okay?
you.
And looking out for each other. Looking out, okay, you're not wearing a mask. I think it's a change of attitude and learning from our mistakes.
We all have to be
Open up.
personally responsible for ourselves. Thank you so
For
much.
ourselves and for our loved ones. Okay?
Thank you so
and for our
much.
loved ones.